Bonjour à tous et à tous. Welcome to this event. My name is Wina Darius, and I will be your host this afternoon. I would like to take this opportunity to thank everyone for joining us today, all the governmental agencies, the community organizations, and all the attendees present. Before I keep going, I would like to mention that this event is offered in both French and English. So in order to activate your simultaneous interpretation, you have to click on interpretation at the bottom right of your screen and select the language of your choice. Avant de poursuivre, j'aimerais vous mentionner que cet événement est offert en français et en anglais. Alors, pour activer votre interprétation simultanée, vous devez cliquer sur Interprétation en bas à droite de votre écran et sélectionner la langue de votre choix. Cet après-midi, nous allons avoir une discussion entre la recherche, la communauté et la pratique sur les 13 recommandations développées par le Laboratoire de Vulnérabilité, Trauma, Résilience et Culture à l'Université d'Ottawa afin de réduire la surreprésentation des enfants noirs dans les services de protection de l'enfance au Canada. Alors, pendant la première heure, nous allons avoir des présentations par les différents représentants de la recherche, de la communauté et de la pratique. Ensuite, nous aurons une période de questions. Alors, si vous avez des questions pendant les présentations, n'hésitez pas à les écrire dans la section de questions et réponses et nous vous répondrons pendant la période de questions. Without further ado, I'd like to turn the microphone over to Debbie Hoffman, who is the Associate and Executive Director of Children Aid Society in Ottawa, for the opening remarks.
Oh, thank you very much. I appreciate this tremendously, Wina. Thank you. So yes, my name is Debbie Hoffman, and I'm the Associate Executive Director at the Children's Aid Society. And I just wanted to start the event by just making a few comments, giving a bit of background. And so you may know that it was several years ago that we were approached by Dr. Jude Mary Cénat to do research regarding the experience of Black and racialized families, children and youth as it relates to child protection and child welfare more broadly. We knew and continue to know that the experience of racialized and Black families with child protection is not good. And we know this because we collect data on a regular basis and we publish that data. And that data shows that Black families are overrepresented in child protection and that children who come into our care experience disparate outcomes as it relates to how they are doing in our care on many different markers. And this data really is the shame of child welfare, making the research that you are going to hear about even that much more important. Dr. Cénat's research and his teams demonstrates what we've known. And we're grateful for him. We're grateful for him for coming in, working with us, talking to the people who we serve, and creating the recommendations that you are going to hear today. We took those recommendations very seriously, and you'll hear about the recommendations and our response to them from Wendy White, who's going to be presenting today. We are very excited about this time. We're very excited to be here. We look forward to hearing from the speakers and engaging in the discussion, and hopefully being able to answer all of your questions. So thank you very much.
Merci beaucoup, Madame Hoffman, pour les propos introductifs. Je fais maintenant place au Dr Jude Mary Cénat, qui est un professeur agrégé à l'École de psychologie, directeur du Laboratoire de Vulnérabilité, Trauma, Résilience et Culture et directeur du Centre interdisciplinaire pour la santé des Noirs à l'Université d'Ottawa. À vous la parole, Dr Cénat.
Merci beaucoup, Wina, pour la présentation. Puis, je prendrai aussi le temps de saluer plusieurs personnes qui sont présentes, qui ont permis d'avoir cet événement aujourd'hui, mais beaucoup plus important, d'avoir mené cette recherche et la volonté également de Mme Debbie Hoffman, mais également de Mme Kelly Raymond, des responsables également, d'autres responsables également au niveau de la protection de l'enfance à Ottawa. Je citerai Mac Poliquin, mais également Jude Jean-François et d'autres personnes, Wendy également. Ce qu'il faut comprendre, c'est que quand on a commencé, quand je suis arrivé à l'Université d'Ottawa, je me suis dit que l'une des meilleures options, comme je voulais que ma recherche soit une recherche totalement ancrée dans les communautés, la meilleure option, c'était vraiment de rencontrer des organismes communautaires. Et quand j'ai rencontré des organismes communautaires et à la fois des organismes issus des communautés noires et d'autres qui sont des organismes communautaires qui ne sont pas issus des communautés noires, l'une des questions qui a été beaucoup soulevée, c'était la question de la surreprésentation des enfants noirs dans la protection de l'enfance. En fait, maybe I can tell that I'm speaking in French because we have the live interpretation. So if you click on interprétation or interpretation, you will be able to hear me in French or in English, quelle que soit la langue que je parle. Alors, je disais qu'en rencontrant ces gens-là, j'ai compris que c'était important de travailler sur ces enjeux-là. Et comme j'avais déjà travaillé sur ces enjeux-là par le passé, et j'ai commencé à regarder avec des organismes communautaires. Et il faut dire que ce projet est vraiment issu d'une collaboration entre des organismes communautaires, la protection de l'enfance, la Société d'aide à l'enfance d'Ottawa, pour être plus précis, et l'Université d'Ottawa. Et on a voulu vraiment que cette recherche-là ne soit pas juste de la recherche, mais de la recherche qui sert vraiment à pouvoir mettre en place des solutions. Nous croyons que nous sommes arrivés à trouver des solutions qui soient vraiment pas faciles à implanter dans le sens que c'est facile de le faire, mais qui soient vraiment des choses, des éléments qu'on peut vraiment implanter dans la protection de l'enfance. Et donc, aujourd'hui, on va présenter les 13 premières recommandations qui sont issues de ce projet-là. Et nous avons compris que c'était important d'avoir une vraie conversation aujourd'hui entre la recherche que nous représentons, mais également avec les organismes communautaires. Et on remercie Repfo qui nous a accompagnés dès le départ dans ce projet, qui est un organisme de parents francophones et qui va aussi aujourd'hui avoir l'opportunité de faire entendre la voix des organismes communautaires et également des parents, j'ai envie de dire des communautés noires, et également la protection de l'enfance. Et je remercie vraiment les responsables de la protection de l'enfance, les responsables des organismes communautaires qui ont rendu possible cette conversation à trois. Et je pense qu'il y a un aspect inédit à cette conversation-là. Et je pense que c'est une conversation qu'on doit continuer. Nous continuerons si les autres phases de la recherche nous permettent de dégager d'autres recommandations. Eh bien, à ce moment-là, nous ferons de même pour continuer à avoir de vraies discussions entre les organismes communautaires, entre les communautés noires, la protection de l'enfance, mais également la recherche. Parce que l'une des choses que notre recherche a montré, c'est que les universités ont aussi leur rôle à jouer. Et souvent, les universités restent en arrière. Pourtant, c'est le premier rôle à jouer pour aider les intervenants de la protection de l'enfance à mieux comprendre les enjeux raciaux et culturels. C'est un rôle des universités et des collèges. Je vais en profiter pour introduire la première personne qui va prendre la parole au nom du labo aujourd'hui. Il y aura trois prises de parole pour présenter les résultats. D'abord, on aura Sarah Emily Mackenzie, qui est étudiante au doctorat à l'école de psychologie à l'Université d'Ottawa, doctorat en programme clinique, qui a participé dès le départ dans cette recherche. Il y aura également par la suite Johanna Mukunzi, qui fait partie de l'équipe de départ du projet. Et puis, en dernier lieu, il y aura Elisabeth Dromer, qui a travaillé sur les recommandations avec un œil à la fois externe et interne, et de pouvoir relever toutes les recommandations à partir de toutes les publications, des publications qui ont été déjà faites et d'autres publications qui ont été soumises. Alors, je vais passer la parole à Sarah Emily qui va d'abord vous parler de la revue systématique que nous avons menée, qui vise au fait à comprendre les disparités raciales dans la protection de l'enfance, mais surtout dans l'objectif de pouvoir mieux agir. Sarah Émile.
Merci beaucoup, Jude. Bon, et merci, Johanna, qui est en contrôle de la présentation. Donc, oui, comme I'll actually switch to English for the presentation. So as Dr. Cénat was saying, we will be presenting first on the various studies we've done in the context of this project. So examining the racial disparities and overrepresentation of Black youth in child welfare. The first study that I will present is the systematic review that we've done. Now, we wanted to look at the literature and get a good sense of what has been done in terms of data collection so far and what it is that we know from other people's work. So the aims of our study were to find out first if whether or not there are racial disparities within the child welfare. We wanted to know also if there is, in fact, an overrepresentation of Black youth within these services, and specifically in countries where Black communities are a racial minority. We also wanted to examine the risk factors for the overrepresentation of Black children within these services. So to do this research, we use key terms that would pull all of the previous published articles that are related to the topic. So in English, we would have combined terms such as child welfare, race, ethnicity, Black, racial bias, and we also use the same equivalent terms in French. Now, in total, we ended up with 37 articles that had to do with our topic of interest, and we found that the studies from these articles were all conducted within Canada, the US, and England. Now, we found that 27 out of 31 of the articles reported that Black children were in fact overrepresented or disproportionately represented across the various stages of involvement in child welfare services. And by the various stages, these include, you see the list below here, the report of investigation, allegations of substantiation, out-of-home placements, re-entry to foster care, lower reunification rate for Black children, the exits to permanency, and that's to say that Black children were less likely to be adopted, and then also ongoing services. Now, in terms of risk factors, one that we've identified is in terms of socio-demographic factors. So we did identify that gender, race, and socioeconomic status appear to be reported frequently as risk factors for Black youth being overrepresented in child welfare services. So to give you a few examples, you'll see that here we've listed that Black girls were transferred to ongoing services at higher rates than boys. In terms of race, well, that was the primary risk factor that was reported in the studies that we found. And then in terms of socioeconomic status, we found that Black children and adolescents in a lower SES context were more likely than white children and adolescents living in similar circumstances to be subjects of reports of allegations. Now, the other category of risk factors is racial discrimination. Now, we thought it was important to give it its own category because of how often it was coming up and also the context in which racial discrimination was reported. So you'll see here that we found we found racial discrimination to be a risk factor in terms of referrals to child protective services and in terms of reason for investigation. So here you see for reason for investigation, the subjects of allegations of neglect, physical abuse, and sexual abuse or caregiver intimate partner violence. These were most likely to be the reasons of investigation in Black children. And now I will pass it over to my colleague, Joanna.
Thank you, Sarah Emily. So I will be presenting the next portion of the studies that came from this. First one is entitled Racial Disparities in Child Welfare.
Joanna, je suis désolée, Joanna, est-ce que tu nous entends? Joanna, il y a une coupure et il n'y a pas de caméra.
Oh, désolée.
Ouais, il y a une coupure également dans ce que tu dis.
Désolée. Est-ce que ça va?
Ça va mieux maintenant.
Parfait. Okay, sorry about that. So thank you, Sarah Emily, for presenting the first study that came from this research. So I'll be presenting the next two studies that we conducted on this topic. So the first one is entitled Racial Disparities in Child Welfare in Ontario, Canada, and Training on Ethnocultural Diversity, an Innovative Mixed Methods Study. So the aims of this research were really to examine issues concerning the training of caseworkers in association with the overrepresentation of Black youth in the Children's Aid Society. So in order to investigate this, we conducted qualitative interviews with CAS caseworkers and community facilitators in Ontario. So just so we're all on the same page. So CAS caseworkers refers to CAS employees who work with families, and their role is really to protect infants, children, and youth who are experiencing or are at risk of experiencing all forms of abuse or neglect. And community facilitators refer to members of associations, organizations, or religious leaders who act as a bridge between the CAS and families. So really to help families navigate the CAS system and the complex web that comes with that, with involvement with the CAS. And the second aim of this research was to examine ethnocultural diversity training in Ontarian social work programs. So in order to do so, we did a documentary analysis of academic curriculums from all Ontarian colleges and universities that offer a program in social work. Okay, so in terms of the design of the study, just to go over it briefly. So we did qualitative interviews with CAS workers who, as well as community facilitators who have been involved with Black families that came in contact with the child welfare system. They had to speak English or French. And to analyze the data, we conducted grounded theory to code the interviews. So here is a brief overview of the participants in the study. So we had an even mix between Anglophones and Francophones. And in total, we had 24 participants coming from both the CAS and community facilitators. In terms of the themes that emerged as a result of this study, so I'll go over it from the point of view of community facilitators as well as caseworkers. So one of the theme that emerged from community facilitators is the lack of training, so insufficient training. So these are quotes that come from the qualitative interviews that were done with community facilitators. So really here, one said, agents, workers, caseworkers, they do not have the training. Another one said, I also think that the source of that information is critical in making sure that in the training that the culture sensitivity is actually there, because microaggressions to racism is passed off as, oh, this is my blind spot, sorry. But sorry, and this is completely unacceptable. So really seeing that community facilitators are seeing a lack of training in terms of cultural sensitivity. Another theme that emerged was community facilitators is the lack of representation. So again, just to give you some quotes that came up in the qualitative interviews. So a lot of staff just across the board in CAS do not represent the communities that they serve. Another one is, I think there could be a collaboration of both the theoretical understanding and there is another piece of the experience. So really saying that people that have the lived experience could also contribute to the theoretical understanding. Okay. And now some themes that emerge from Cs caseworkers. Again, we see insufficient knowledge or training. So here we have a discussion between caseworkers. So training was so long ago, I don't remember. And then another one saying, yeah, well, I think we are not prepared. The other one agreeing, we haven't been prepared. I mean, how about just let me put it out there? Like, you know what, when I think 10 years back and today, I think things have improved definitely, but there is still that perception of the training being so far back and being insufficient. Another one says, as it's been a long time, yes, that I've done it. It's been like what, like 18 years that I'm here, and that makes that training old. But it gives us awareness on reality that I've told you before. So from the caseworkers' perspective, they do have training, but it's dating far back. And it might not apply to the current services that they provide. Okay. Okay, and then another theme that emerged from CS caseworkers was the informal learning through experience. So some of them said we are our own work tools as caseworkers. We're our own people. We're human. When we meet a person and I let the person tell their story, you know, we are humans. We are able to create bonds. We are able to understand, I think. We are our own work tools. You could do all the trainings and not have that fiber in you. So this person was really discussing how they have learned on the field. And this other person is saying, yeah, I think that like the trainings that we received versus learning from families with which I got to work with, I learned more from families than the training that I got. So again, this person is saying that part of the training is really done on the field. Okay, so just to give kind of an overview here of the results that came from the qualitative interviews in terms of training on ethno-cultural diversity. So the community facilitators were really finding that there's insufficient training, the sources of education or training are not necessarily adequate, and there is a lack of representation. And on the caseworkers' end, they were finding insufficient knowledge or training as well. They noted the importance of diversity training and representation. And they also noted that some of their training came from the field. And so we find that all of these factors kind of are related to the racial disparities and the overrepresentation of Black children in the child protection services. Okay, so the other part of this study was to analyze curriculums and social work programs in terms of ethno-cultural diversity training. And so we analyzed undergraduate social work programs in Ontario, as well as whether these courses were mandatory or optional. And in all of the 48 institutions, 36 of them offered social work programs. So here, just to kind of look at a breakdown of the curriculums in social work on ethnocultural diversity training, 52% of them had mandatory courses, 16% had optional courses, and 30.55% had no courses at all offered. So what came of this study is that there really seems to be an incomplete training in terms of the CS workers that leads to a lack of cultural incompetence, and there needs to be better training at educational and institutional levels, because we see that almost half of the programs will have students graduate without having taken a mandatory course. And workers should really aim for ongoing education in terms of cultural competence, because as we saw, a lot of workers reported that their training was really a long time ago. Okay, so now I'll move to the other study that we conducted, which was entitled "The 7 Reasons Why Black Children Were Overrepresented in Child Welfare System in Ontario, Canada," a qualitative study from the perspectives of caseworkers and community facilitators. So the aims of this study were to evaluate the reasons why Black children are overrepresented in the child welfare system through focus groups with caseworkers from a Children's Aid Society and community facilitators in Ontario, Canada. So for this study, we conducted qualitative interviews with CS workers and community facilitators. It was the same interviews that I mentioned in the previous study. So we had 24 participants. And to analyze the data, we did content analysis on the focus group data. So we read through the transcripts of the interviews and we coded the data, and this allows for concepts to emerge from the data without being guided from prior assumptions or hypotheses from the research team itself. So the results that emerged from this study, so CS caseworkers noted that poverty was one of the factors. So here we have a quote. So they said, and then, so what happens on PD days when, you know, the children aren't at school and older siblings might be the one watching the children? We got a lot of calls in regards to siblings at home or stuff like that, or the kids, but the parents can't take the day off. And that becomes really difficult for families to manage, and we don't have anything to offer. The waitlist for childcare subsidy is often like, forget getting in. So this person is really relating that poverty is one of the factors that leads families to CS services. And this specific example is that, you know, they don't have access to childcare subsidy, so they rely on siblings to watch their children, and then that leads to a CAS call. Another theme that emerged was insufficient community support and network in Canada. So here again, this was brought up by CAS caseworkers. So from the interviews, one CS caseworker said, when they don't have that support system and they are newcomers, that is definitely, I believe, one of the factors to the overrepresentation, because they can't turn to their neighbor. They can't turn to their friends down the street because they're not there. So again, just a lack of support from their community because they don't have a neighbor that they can rely on to help them in situations of difficulty. And then another theme that emerged was the mental health challenges that are faced by Black families that are involved with the child welfare system. So here, some quotes from CAS caseworkers were, imagine how many people come here fleeing the war, and that much trauma and how it comes out, you know, in different phases and how they might throw that anger. And then another one said, there is also a certain lack of understanding of mental health, especially when they haven't been in Canada for many years. It's either taboo or it's not recognized. It's something else. It's evil spirits. but mental health can be difficult to accept. So here they're relating that some of the families are dealing with mental health challenges, and that leads to them being reported to CAS. Okay, so here we have racism, which was highlighted by CS caseworkers as well as community facilitators. So one CS caseworker said, one of my first classes with another person who was participating was the school calling because they weren't sure if the kid had cigarette burns all over their body or mosquito bites. And 5 minutes with this kid, he was sitting there, he was scratching, he had eczema, and mom was frustrated because this was the third opening from the school for very silly reasons. And this, in my opinion, it was because of the color of his family, and that's so unfair. So here is a child that was reported to CAS because there were kind of pointers that they might have been physically abused. So they were thinking that it could be bruises, but this caseworker realized very quickly that it was eczema, and that this family had been reported multiple times for this reason, which was silly because there weren't any signs of physical abuse. And then here a quote from a community facilitators. In the schools, a lot of Black kids being expelled and suspended, punished more harshly than other kids, and it easily translates to the caring system. Like this person was, why is she angry? Why is she so confrontational? Something is going on at home. That whole vibe, like being judged like more harshly and more so than someone else who is not Black. So again, this community facilitator is reporting that because this person is Black, they're being judged more harshly than their white counterparts, and then being referred to the CAS. Okay, and here we have disciplinary practices that came from CS caseworkers as well as community facilitators. So in the interest of time, I'll just read a quote from the CS caseworkers. So here we had 3/4 of the Black family cases, I tell you, are physical discipline. So it's a lot in terms of education, and often they don't know our laws, but I always give the example that if I moved to Haiti, for example, and I was told that from now on you have to discipline your son with a belt, I would have a lot of difficulty too. So this caseworker really highlighting that there are cultural differences in terms of discipline, and that she recognizes that they would also have difficulty if they had to suddenly change their discipline practices. Okay, and then cultural differences also emerged as a theme in community facilitators. So here we have a community facilitator describing an event. So the child was like very exhausted, lethargic. They were wearing a hijab and it was summertime, it was Ramadan, so they were fasting. They weren't drinking, and then it went from the clinician finding out to calling CAS, and then CAS got involved because this is negligent. You're not feeding your child is exhausted, there's mental health distress, you're not parenting correctly. And it escalated completely and then had huge detrimental impact on the work that I was doing in the community. And then that was a clear example of how a family was deterred from getting mental health support that they needed and then being put in the system. So this community facilitator was relating an event when it was Ramadan, so a child was fasting, so they weren't eating because of religious reasons, and they were seeking mental health services. But instead of having access to these mental health services, they were relayed to the CAS. So they were reported to the CAS because they were not eating. And that deterred them from actually seeking the mental health services that they needed because the situation escalated to a report with the CS because they were not eating, when in fact it was for religious reasons, and it was not a case of neglect in this case, but that deterred them from seeking mental health services. Okay, another theme that emerged was a lack of diversity among CS caseworkers. So Here is a quote from a caseworker during the interviews. I think that having the experience of more diversity in the pool of workers that work with families is going to benefit the community that we service. And I don't think we are at that point right now. So just to briefly summarize the results, so we had themes emerge from community facilitators as well as Cs caseworkers. Some of the things were common to both groups, such as discipline and racism issues. And then community facilitators highlighted cultural differences. And then caseworkers highlighted insufficient community support, mental health difficulties, lack of diversity in CAS, as well as poverty. So in terms of general discussion, what we see is that there are structural and institutional reasons for the overrepresentation of Black youth in the child welfare system. And hiring individuals from ethnoculturally diverse backgrounds as caseworkers is important in order to better reflect the current diversity of children who are involved with the child welfare system. And child welfare agencies should also commit to establishing training programs that can assist with the implementation of anti-racist, anti-oppressive, and culturally sensitive services in order to better serve ethnoculturally diverse population. And lastly, an increased partnership with community organizations that are able to assist families with their needs, such as mental health needs, integration to Canada, as well as social support, and the financial insecurity is really needed to better address the actual needs of families. Okay, so now I'll pass on to Elizabeth, who will discuss the next section.
All right. Hello, everybody. I'm very happy to be here with you to share the recommendations that we've been talking about. And before I start, I just want to say that because of time constraints, really, this is a very short overview of them. So I encourage you to go and read a recommendation booklet. There's going to be more detail about each one in there, and it should be available on our website, I believe. So let's go ahead and get started. So the first recommendation is that all colleges and universities in Ontario and Canada need to offer a course on anti-racist and anti-oppressive practices to social work students. So this training should address issues related to racial prejudice, racial discrimination and disparities, and systemic, institutional, and interpersonal racism present in the CAS. So it should also address strategies and practices that can be used to eliminate them. And we believe this sort of training should be evaluated, and that social work programs that do not offer such courses, it just should not be accredited. Our second recommendation states that all Ontario and Canadian colleges and universities should offer a course for students in elementary and secondary school education on anti-racist and anti-oppressive practices and racial issues. So that's because teachers tend to report children from racialized communities more quickly than other children. And so this training should be offered to both prospective and current elementary and secondary school teachers to really help reduce existing racial disparities found in the rates of reporting, but also to help teachers take an anti-racist approach that should be appropriate for all students. Third, all workers who interact with youth or families or who are part of the decision-making chain within the Children Aid Society, they should have completed anti-racism, anti-oppression, and cross-cultural training. So all caseworkers should be appropriately trained on cultural issues related to intervention, so before they begin their work. But for those who aren't, training should also be offered to fill the knowledge gaps that they might have. And we recommend that all workers be annually and anonymously evaluated, and that the training programs really be updated based on the results and the needs expressed by those workers in the evaluation. Our fourth recommendation is that the CAS should provide ongoing training on racial issues to their caseworkers. So not only should all workers receive this training in the first place, either before starting their careers or at the beginning of their careers, but training really should continue throughout their professional lives. So by being more educated about issues related to unconscious biases and systemic racism, stakeholders could engage in a more proactive anti-racism. Next, our fifth recommendation states that CAS needs to involve racialized communities in agencies by giving them real power. I don't know if you, yeah. And so we believe that this could be done by establishing advisory committees to bring together community facilitators, parents, and racialized researchers to be involved in the training of social workers and stakeholders. And so these committees should work on different levels, but mainly on real life examples, cases that would be presented by stakeholders anonymously. And caseworkers should take that opportunity to ask advisory committees to provide new perspective that might not have been thought of previously. Right, so recommendation 6, the impact and effectiveness of multicultural anti-racism and anti-oppressive training should really be continuously evaluated. So more specifically, periodical evaluation should be done to see whether or not the training is actually having an impact on the attitudes and the skill of caseworkers and trainees, but also to see if the training helps reduce existing racial disparities. And depending on the results of the evaluations, we should take the appropriate modifications, like they should be made to the training, the right changes. And then recommendation 7, CAS should hire more caseworkers from diverse ethno-cultural backgrounds. And that really would help to better reflect the diverse backgrounds of the children and the families that are served by the child welfare system. And it's a key factor in developing better practices. And that effort, it shouldn't just be made for caseworkers, but also for the hiring of managers, judges, and other professionals involved in the child welfare system. Our 8th recommendation is that CAS should try to keep children in their home environments as much as possible. And so to do this, CAS should develop partnerships with community and faith-based organizations to really help build trust with families. And this would help caseworkers work in a more peaceful, supportive, and non-confrontational manner. And it could also provide some stress relief for parents by offering them a sense of security, and also by reassuring them that they can count on their community to help them make positive changes in their environments and within themselves to maximize the children's well-being. Recommendation 9 is that governments and child welfare agencies should adopt clear protocols to better address racial issues. And so these should include the adoption of anti-racist and anti-oppressive investigations and placement practices, but also the establishment of a clear contract on racial issues in institutional practice. There should be clear procedures for dealing with racialized communities and a set of questions to consider when recognizing whether an intervention is anti-oppressive and anti-racist. And we think caseworkers should also complete a form after each intervention to make sure that anti-oppressive and anti-racist practices are put in place. We also believe that CAS should provide a biannual report on the implementation of anti-racist and anti-oppressive practices and their impacts in reducing racial disparities. For number 10, our recommendation number 10, what it explains is that we think policies are needed to reduce racial disparities and the overall number of Black youth in CAS. And so CAS should encourage the development of parenting practice training modules. So what does that mean? Basically is that the training could be used as a prevention tool and as a method of intervention. And we think it could take the form, for example, of a booklet that could be given to parents at the hospital after the birth of their child, on multiple topics, but for example, on safe and effective discipline methods. Our 11th recommendation is that the Ontario Association of Children's Societies and each CAS should develop a clear plan to eliminate racial disparities and overrepresentation of Black children over a 10-year period. And so this plan, it should have annual goals, and we think it should be drafted by a joint body that includes CAS, Black community organizations, Black parents, school boards, and public health. And the progress of this plan should be evaluated every year, and the plan should be really adjusted as needed based on the evaluations. Our 12th recommendation is that mental health care services for parents and families should be created within the child welfare system. Because since parental mental health is a key factor in the overrepresentation of Black children in the child welfare system, the lack of support and inaccessibility of mental health services really prevents Black parents from regaining the ability to take care of their children. And so it's critical to help Black parents access adequate mental health care to then help them overcome any psychological problems that they may be facing. And finally, our last recommendation, what it states is that measures must address, if you can just go to the next slide, sorry. Or yeah, perfect. No, sorry, you're on the right one, the number 13. Our last measure is that a recommendation is that measures should address structural risk factors faced by Black families. So like poverty, racial bias and discrimination, access to health services, and access to education, because addressing structural risk factors, while they are difficult to change and they might be the recommendation that is about the biggest change, those are more likely to help eliminate racial disparities in child welfare systems in a way that is sustainable. And so we need to put in place structural programs to help, for example, eradicate poverty in Black communities. And these programs should really try to separate skin color from socioeconomic status, because that really accentuates unconscious racial biases. And we should also give special attention to parents living in poverty who may have stigmatizing attitudes when it comes to mental health services, because possibly have previously experienced racial discrimination. Because really, in the end, protecting children also means supporting parents. So this is a very, very brief overview of our recommendations. Thank you very much. And I really encourage you to go on our website and to look at our recommendation booklet. Thank you.
Thank you so much, VTRAC Lab, for this presentation. Je veux juste prendre le temps de mentionner que le cahier de recommandation sera disponible sur notre site web dans environ 24 heures sous l'onglet ressources. Ça serait donc le cahier de recommandation ainsi que les fiches d'information qu'on a fait sur 2 des articles qui ont été présentés aujourd'hui. Donc maintenant, je vais céder la parole à Cadre, qui est la coordinatrice de l'organisme communautaire Regroupement ethnoculturel des parents francophones de l'Ontario, REPFO, ainsi que Samantha Umutoni, qui est une thérapeute et travailleuse sociale à REPFO. À vous la parole.
Merci, Wina. Je suis très heureuse d'être ici avec vous aujourd'hui. Je veux présenter la prestation des services adaptés culturellement de REPFO avec la Société L'aide de l'enfance et d'autres organismes. Ouais. REPFO, c'est un organisme de regroupement ethnoculturel pour les familles francophones noires qui a été établi en 1998 et spécifiquement favorisé pour la croissance, le développement des enfants et des jeunes familles et les familles noires. Tu peux changer le diapo, Samantha, s'il te plaît. Okay, il y a quelques faits et réalités dont nous, comme REPFO, qu'on avait constaté et observé depuis que nous travaillons avec les enfants référés par la Société L'aide de l'enfance, plus représentés dans les services de l'aide à l'enfance que les enfants blancs, admis dans le système de protection 2 fois plus vite que d'autres populations et risquent d'être référés à la société par les écoles, les professionnels médicaux, les travailleurs sociaux et les voisins même dans la communauté. Manque de sensibilité et bias culturel, comme un enfant noir dit « je me fais frapper » et tout de suite au téléphone pour faire un signalement. Car avec la mentalité qu'un enfant noir n'est pas bien discipliné, il est discipliné par battre l'enfant, d'abuser l'enfant, alors immédiatement il y a un signalement. Versus qu'un enfant blanc, je me fais frapper, ben bien, ok, hein, ça va, essayer de comprendre, peut-être il a fait des choses mal. Et ça, c'est une manque de sensibilité culturelle peut aussi affecter les évaluations et les comportements parentaux. Susceptibles d'être emmenés hors de leur maison pour être placés dans des maisons d'accueil pour des longues durées, ces derniers grandissent dans ces maisons sans adoption. Il y a aussi susceptible à vivre la discrimination et la microagression comme un regard méprisant ou hostile, ainsi que vivre le racisme dans les maisons d'accueil et des foyers collectifs. À Repos, on a remarqué depuis 2018, il y a un manque de suivi auprès des travailleurs ou bien des travailleuses dans le service de SAE. Une fois que l'enfant rejoint la famille d'accueil, il faudrait que les gestionnaires demandent des comptes rendus plus régulièrement à leurs intervenants. Il faut être formé pour poser les bonnes questions. Alors, les intervenants et les gestionnaires nouvellement embauchés devraient suivre une formation sur la lutte contre le racisme afin de fournir des services adaptés aux enfants noirs et les familles noires. Les SAE doivent avoir amélioré le dialogue avec la communauté noire et se laisser guider par elle en matière de formation à fournir. Avec la sensibilisation culturelle, on peut accompagner comme REPFO et d'autres organismes noirs qui accompagnent les familles noires afin de s'assurer de tenir compte du contexte spécifique de cette communauté. Il y a des études de dizaines d'années, mais rien ne change. Et ça nous amène, avec le racisme établi, les élèves noirs sont suspendus un plus haut taux que les autres dans les écoles, un taux bas d'emploi et revenus pour les mêmes niveaux d'études, même s'ils sont diplômés dans des écoles supérieures. Les familles d'où viennent ces enfants vivent dans un cycle vicieux de la pauvreté. Alors, il y a le diapo sur un cycle vicieux aussi qui résume brièvement les banques, les logements, l'éducation, la santé publique et la justice pénale. En parlant un peu sur le logement, les familles noires, surtout les nouveaux arrivants, ou bien les familles qui sont appliquées à la société de service social de l'Ottawa, souffrent plus 10 fois que les autres familles. Il y a des pressions qui viennent envers les propriétaires, même s'ils sont en retard de 2 jours de paiement de loyer. Il y a des harcèlements et des discriminations au niveau de leur emploi ou de logement. Il y a une peur intense auprès des parents noirs et manque de sécurité. Il y a il y a la santé mentale qui est affectée. Il y a une peur que les enfants vont être signalés. Les familles, il y a la pauvreté. Les familles, des fois, ils n'ont pas un travail suffisamment qu'ils peuvent nourrir leur famille et vivre une vie plus pertinente. Alors, il y a toujours la santé mentale qui est là, l'inquiétude des parents qui s'inquiètent. Qu'est-ce qui va se passer dans les écoles, d'être perturbés et dans ces situations. Alors, il y a les harcèlements à base raciale et la brutalité policière aussi, assassinats comme les policiers, comme le cas de Abdurrahman Abdi. Il y a un casier judiciaire à cause de la cible raciale et le système pénal ou les policiers envers les jeunes noirs et les ethnoculturels. Il y a un taux très élevé de chômage. En travaillant avec la communauté large francophone de l'Ontario, il y a toujours des difficultés et des inquiétudes concernant le chômage. Il n'y a pas assez d'aide, surtout avec la pandémie et la situation difficile du COVID-19 qui se passe maintenant. Alors ça aussi, c'est un cas plus dur, plus sérieux pour ces familles noires et les difficultés qu'ils vivent tous les jours. Merci.
Merci beaucoup, Cadra. Alors, nous avons constaté 10 problèmes que rencontrent beaucoup de jeunes et des familles avec lesquelles nous travaillons, mais la plupart ont déjà été mentionnés dans la présentation et dans la recherche. Mais ce que je tiens à souligner aussi, c'est que nous constatons que le racisme au niveau scolaire, dans le système d'éducation, est beaucoup plus présent, notamment avec les enfants avec lesquels nous travaillons, où les enfants noirs sont beaucoup plus susceptibles de se faire sanctionner plus sévèrement par rapport aux enfants blancs. Ceci est également pareil lorsqu'il s'agit du système judiciaire, où nous voyons les jeunes noirs beaucoup plus représentés. Il y a un discours aussi qui remonte avec les jeunes avec lesquels nous travaillons et même leurs familles. Parfois, cet aspect du manque de reconnaissance de l'excellence des Noirs, donc des Noirs qui arrivent à remonter, à être résilients et à remonter à l'échelle un peu de réussite, ils ne sont pas reconnus, ils ne sont pas célébrés. Et ça vient un peu affecter psychologiquement et aussi sur l'estime de soi de ces familles-là. Et il y a aussi un autre discours qu'on remarque qui est le manque d'une représentation, donc pas assez de leadership, de rôle de leadership sur lesquels ils se réfèrent. Donc, ceci vient un peu les mettre dans une position de vulnérabilité. Alors, ce que nous constatons lorsque nous travaillons avec les jeunes noirs et qui sont référés par la SAE, et nous voudrons un peu, cette fois-ci, parler un peu aux intervenants de la SAE qu'ils puissent adopter une approche culturellement adaptée, donc avoir cet aspect de l'humilité culturelle, de comprendre la culture de l'autre, d'accepter la différence et d'avoir aussi parfois ce regard un peu acceptant et comprendre le vécu, la culture, la différence et l'incorporer dans la pratique. Ceci aura plus tendance à donner des résultats positifs. Et aussi parce que les enfants en général qui vont dans des familles d'accueil, ils se retrouvent dans une culture différente, ils sont incompris. Donc, ce crochage-là et cette tension qui puisse exister entre son nouvel environnement, c'est un problème, ça peut aussi être perçu comme un choc. D'où l'importance pour les intervenants s'ils ont cette humilité culturelle, ils vont pouvoir intervenir d'une façon appropriée. Alors, comment utiliser une approche appropriée et aussi individualisée? Donc, essayez aussi de comprendre que chaque enfant, chaque jeune et chaque famille est différente. Il est important pour les intervenants de la SAE qu'ils comprennent le parcours de chaque famille parce que chaque famille a un passé, a des vécus différents. Donc, essayez aussi de les comprendre pourra contribuer à établir un plan d'intervention approprié à chaque enfant et à chaque famille. Il faut aussi que les travailleurs sociaux de la SAE essayent un peu d'adopter une posture critique de certains stéréotypes et préjugés qui existent au sein même de la SAE, de les remettre en question et essayer aussi de les écarter lorsqu'ils vont intervenir avec ces familles-là. Essayer d'encourager les familles, trouver beaucoup plus leurs qualités et travailler en se basant de ces qualités-là dans le processus de trouver des solutions durables avec ces familles. Il est important aussi que les intervenants de la SAE viennent trouver des ressources dans la communauté. Nous sommes là, nous sommes disponibles et nous sommes prêts à aider lorsqu'il le faut. L'aspect de la santé mentale est très important parce que non seulement le racisme que ces familles rencontrent au quotidien, que ces enfants rencontrent au quotidien, ça les affecte au niveau émotionnel. Surtout, même on peut le remarquer, lorsqu'il y a des décrochages scolaires, la dépression, les comportements inappropriés, les enfants ont du mal à voir un avenir plus clair. Ils se retrouvent dans une dépression majeure et se retrouvent dans une situation de vulnérabilité où ils n'ont pas forcément la capacité de réfléchir sur ce qu'ils voudraient se construire dans leur futur. Donc, il est très important pour les intervenants de réfléchir aussi aux conséquences que le racisme peut causer non seulement sur les familles, mais aussi sur les enfants. Alors, quelques pratiques aussi que nous pouvons suggérer. Beaucoup ont été mentionnées dans la recherche et je peux aussi faire un lien avec nous en tant qu'organisme qui sommes sur le terrain et qui travaillons tous les jours avec les clients de la SAE. Il faut poser des questions. Il faut que les intervenants osent poser des questions, c'est correct, c'est parfait. Lorsque les choses ne sont pas comprises, lorsqu'il y a des éléments que vous ne comprenez pas, c'est bien de poser des questions. Il faut aussi croire que toutes les familles, même si elles se retrouvent dans une situation de difficulté, elles veulent vraiment le meilleur pour elles, pour leurs enfants. Elles veulent que leurs enfants réussissent. Il faudrait plutôt voir intervenir en se basant sur ça plutôt que de tout de suite enlever les enfants. Donc, en comprenant qu'une famille, pour le moment, a des difficultés, essayez plutôt de trouver des ressources pour aider la famille à traverser cette période difficile parce que non seulement nous avons parfois des familles qui ont vécu des traumatismes avant d'arriver au Canada, ils ont vécu des conflits, des situations difficiles. Il faut comprendre aussi ce parcours migratoire avant d'avoir une posture qui juge et d'intervenir d'une façon si je pourrais dire, à la va-vite sans avoir pris le contexte des difficultés que la famille a rencontrées. Donc, il faut aussi que les familles puissent recevoir de cette opportunité de s'engager d'une manière convenable. C'est très important que les organismes considèrent, donnent l'importance aux activités culturelles des familles dans lesquelles ils se retrouvent à travailler. Donc, merci beaucoup pour votre écoute et pour votre contribution.
Merci beaucoup, Madame Ahmed et Madame Mutoni pour votre présentation. Next, we have Mrs. Wendy White, who will be talking about all the efforts being done by the Children Aid Society to reduce racial disparities and service. Mrs. White is the service manager at Children Aid Society in Ottawa. The mic is yours.
Good afternoon, everyone. Can you see me?
Yes, we can see you, but maybe we can ask Mrs. Mutoni to stop sharing the screen to help, to help you to share your screen. Thank you.
Okay. And Tyra will play something. Here you go. Tyra, are you having challenges?
A little bit. The video is just not playing. Give me 2 seconds here.
Okay.
Yeah, so Tyra, if you just want to restart sharing your image and also just make sure that you're sharing sound. All right, it seems that we'll have to go without the video, Wendy.
That's fine. If it's not working, oh, I think that's it right there. Okay. So we will get started. I apologize. We're hoping to share a little clip, and if possible, Tyra, maybe we can play it towards the end of the video. So welcome everyone. I wanted to start by just showing you our 4 pillars. So these 4 pillars are our foundation: equity, diversity, and inclusion, partnership, collaboration, reconciliation, excellence, and innovation. We're very much aware that there's an overrepresentation of Black families involved in child welfare, and that Black families have different outcomes than non-Black families. In fact, they have poorer outcomes than non-Black families. And we also know that our system, which is rooted in colonialism, is not a neutral system. And that for any change to happen, we have to be deliberate and we have to be intentional in the work that we do. One of our guiding principles is to recognize the uniqueness of each child, youth, and family and community, and to provide services that respects their cultures, their traditions, race, and identities. We have this guiding principle feeds into 2 of our strategic goals. One is to achieve equitable outcomes, and the other is to improve outcomes for children, youth, and families. And we talk about equitable outcomes because equity and equality are not synonymous. Sometimes you need to adjust what you do to meet the needs of the family. Sometimes we have to do more in order to counteract all of the systems, including our own, which have worked against Black families. We have to change what we're doing in order to have better results. We recognize that we can't continue doing the same things over and over and then expect different outcome. Next slide, Tara. Thank you. So we're here to talk about the overrepresentation, and I just wanted to ground this discussion in some numbers. These are the stats from our agency, and this is why we're making changes, and this is why Dr. Cénat's team has worked so hard in pulling together these recommendations. Without doubt, there is a disproportionality in outcomes for children and youth from diverse communities. In particular, Indigenous children and youth, they represent 5% of the population in Ottawa, and 29% of the children and youth that we serve are Indigenous, which is almost 6 times greater. When you look at Black families, we're more than double, as the Ottawa population is 6% and our population is 13%. So when you combine these 2 groups, the Indigenous group and the Black population, the total is 11% for the population in Ottawa. Yet at our agency, we have 42% of our children and youth that we work with are either Indigenous or Black. So this slide I'm going to go over very briefly, just so you get a sense as to who works here. This is our workforce, our staff, our volunteers, our board. And we make every effort to ensure that our workforce is diverse and that our workforce represents the communities that we do serve. We are paying very close attention to how we recruit our staff and how we retain our staff. Our hiring practices do recognize the value of lived experience. And as you can see from the graph, we are trending. When you look at our 2014 compared to our 2020, we are trending in the right direction in terms of staff representation. Supporting families and assisting where needed in order to keep the family unit together, strong and healthy, is the quality of service that we strive for. And these 3 areas are some of the methods that we're currently using: signs of safety, family engagement work, as well as the youth initiative. Signs of safety has a catchphrase. It's nothing about you without you. And what that does, that demands that we work with the family, that we understand the family, and that we involve them in the process because it is their process. The family engagement work is about ensuring that there is a network of people that surround and support the family. It's about involving the community, the kin, anyone that the family identifies as a support. It's about really ensuring that this family has a village that supports them. Now, placing a youth outside of their home is always the absolute last resort. There are just too many Black youth growing up in here. We have 2 youth initiatives. One focuses on reducing group care numbers, and the other is preparing the youth to exit care. So these 3 strategies, the youth initiative, the science of safety, as well as the family engagement work, are strategies that we use for all of our families, regardless of race, ethnicity, or culture. But there are also some strategies and processes that we have, some new strategies and processes that we've implemented to improve our work and our outcome for Black families. So the title of the next 2 slides I find are very significant in the work that has to be done. These 2 next slides are where the change happens. Starting with our workplace. In order to do good work, we need to ensure that our organization is healthy, that we have a healthy work environment. It's about checking yourself before you can check out others. So part of this starts with mandatory training. We have 4 days of mandatory equity and child welfare training, and it's for all frontline staff, all managers, all directors. The training, as I said, it's 4 days. It's a comprehensive training, and there are a variety of topics, including intersectionality, power, oppression, anti-Black racism, disrupting oppression, exploring privilege. It's an in-depth training, and it's formal training, which is great because training is needed. But training is only one piece to the education. It is a significant piece, but it's also an insufficient piece. Ongoing discussions are needed in order to really take the theoretical and kind of land it home. Now, our ongoing discussions happen through peer-to-peer discussions, in supervision, in various avenues, but also we have an equity forum that happens monthly. And the equity forum it's a 1-hour session where the committee organizes a variety of topics on all things equity, diversity, and inclusion. And they share these topics through storytelling, videos, and trivia. And all staff are welcome to attend the training, to attend the equity cafe discussions. So these are some of the things that we're doing internally, but we also look to the community for recommendations. We look to the community for support as well. We have 2 community advisory committees. One is an English advisory committee, and we also have a Black French-speaking community advisory committee. Now, they provide us with recommendations and suggestions on how we can better service families and how we can improve our work or just do our work differently. Collecting data on the identity of families. So this is another area of focus that we have been paying close attention to. How could we possibly offer good service or recognize trends or change our practice or incorporate new strategies or work with the community unless we know who we're serving? So collecting data on the identities of our families is something that we're also paying close attention to, and that we're also having ongoing discussions with our staff about. Another new element are we have 2 new positions. We have a frontline equity, diversity, and inclusion position, and we also have a family engagement worker who specializes in equity, diversity, and inclusion. Now, these 2 newly created positions, they bridge services for families, they connect with the community supports, and they're a resource for both the family and for the worker. When we talk about affinity committees and forums, in doing this work, in achieving equitable outcomes, in reducing racial disparities, we also look for input from our affinity committees and our forums. Umoja is an affinity committee for Black staff, and Wawanishka is an affinity committee for our Indigenous staff. Our three forums are our First Nation Inuit Métis Forum, our Queer Forum, and our Equity Forum. So we seek input from these committees and forums about the work that we're doing or the work that needs to be done. Now, there's a lot of new things that we've implemented over this last year. Another very new process is the cultural circle. So what is the cultural circle? If there's any consideration of a placement or court involvement involving a Black family, child, guardian, a cultural circle must happen before attending court. So these cultural circles, their requirements for any file again prior to going to court. Now, the cultural circle is a discussion. It's a discussion that occurs with essential individuals involved in the case to strategize, to brainstorm, to develop creative ideas. And what it does, it identifies and highlights the importance of culture, traditions, and community for the family. The cultural circle centers the family's identity within the work, recognizing that intentional attention to culture and identity is a needed requirement in order to address the overrepresentation. Now, as I mentioned before, maintaining the family unit is always our first endeavor, but it's not always possible. We do know that family, community, and traditions are fundamental to the well-being of children in youth, and that every possible effort must be made to keep these ties strong. So our identity and security plans are plans to ensure that every Black and racialized child and youth retains their identity, their connection to kin, culture, community, and faith while in care of the society. The Rights and Responsibilities booklet. These are booklets that workers must review and discuss with children and youth at various intervals. So the booklet has recently been completely revised, and there is now a page that's dedicated to the child's identity, the child's race, culture, sexual orientation, gender identity expression. And as we've made these changes for children in care, we've also made changes with the work that we're doing with our foster parents. Foster parents now also have required equity in child welfare training. It's not as intense, it's not as lengthy or as intense as the 4-day for staff, but it is required training for our foster parents. And in this training, it includes, we talk about identity, safety, and security for youth. And we also go beyond that because we focus not just on identity, but focus on affirming the identity of children and youth in their care. Our service delivery model. So this pilot excites me. So we have a new pilot, a service delivery model for Black families. And what this is about, it's about slowing down the process. Before contacting the family, the worker and the supervisor have a conversation about culture, race, beliefs, systemic oppression, biases. How does it play a role? How does that play a role in this family situation? What considerations need to be taken into account? And what does it mean for the worker? This is where you go beyond the ticky box. You know, when you check off race, you say, check off, yes, the family is Black. Now the question is, yes, they're Black, but what does it mean? What does it mean for them? And what does it mean for the worker as well? And one of the reasons why I'm so passionate about this service delivery model is because now you have to talk about race and culture. You have to be intentional and you have to bring those elements to the forefront. And talk about what does it mean for the worker? What beliefs do the worker bring into this relationship with the family? People are not neutral. We all come into situations with our beliefs, our biases, our opinions. So knowing that all of our interactions impact the outcome. So this service delivery model slows down the pace. We become intentional. We bring race alive. We talk about why it's important. We cannot work without a family without talking and discussing their identity. The other new piece for this pilot is that, as I mentioned, the cultural circle before, for this new pilot, any FA that's determined that will remain involved for a longer period of time, that will remain involved ongoing, then that cultural circle that I previously mentioned is also triggered at this juncture. So the cultural circle will sit down with the team and ideally with the family to talk about what needs to happen and how can we leverage your culture. Collect and share data. We can't do this work alone. We do seek input from the community. We ask about what do we need to change? What do we need to review, revisit, revise? What needs to be done, or what should we do differently? And to evaluate our programs, we have to ensure that what we're doing is working. What successes have we noticed? What's not working? There was a logo that quality insurance has, or that I've heard, and that's that which gets measured gets done. Right? We need to measure what we're doing to ensure that we are progressing in our desired direction. And by evaluating our programs, this data allows us to identify, document, and measure. Because we know that given everything I mentioned, that there will be successes, and we want those successes documented. Now, how do we know that we're moving forward? How do we know that we're making changes, that we're improving outcomes, and that we're altering our course? How do we know that we're ensuring equitable outcomes for Black families? And this is by looking at our key performance indicators, our KPIs. So our 4 KPIs are listed here. This is where we look for improvement. That once we measure it, it'll show that through everything I've just mentioned, through our training, our mandatory training, through our ongoing discussions about anti-Black racism, through our equity forums, through our recruitment and retention strategies, through our new service delivery model, and through ongoing discussions about equity and oppression, that through all of these avenues, that there will be change, that all of these processes and strategies that we're using will bring us to one place, and that is to reduce the racial disparities and outcomes for Black families. Thank you.
Thank you, Wendy, for this presentation, and thank you to Rep4 and also the VTRAC. We have a lot of questions, and it leaves, I think, 6 minutes. So I will go with the first question. The first question is from Marc Molga. Merci, Dr Molga, aussi d'être présent. Je vais y répondre pour dire que c'est un travail que nous sommes en train de faire présentement. Je fais partie d'un groupe qui fait ce travail présentement, et ce n'est pas seulement en travail social, mais également en psychiatrie et en psychologie, où l'une des choses que nous avons remarquées, c'est que par exemple, en psychologie, de manière générale dans les universités, on va dire aux gens, on va dire aux enseignants d'adresser les enjeux culturels et raciaux. Et quand on regarde les plans de cours, souvent, ce qui est seulement noté, et même quand on regarde des slides de cours, des PowerPoint, ce qui est noté, c'est important d'adresser les enjeux raciaux. Et les étudiants posent souvent cette question-là, comment on le fait? C'est quoi les processus pour le faire, mais souvent, on va s'arrêter juste à dire c'est important de les adresser. Et dans les plans de cours, il y a souvent des statements, des énoncés pour dire que dans ce cours-là, on adresse les enjeux raciaux et les enjeux culturels, mais on ne dit pas trop, on ne dit pas plus par rapport à ça, et c'est important que les plans de cours puissent en dire plus. Après, c'est vrai que hier encore, je travaillais dessus et dans certains plans de cours, on voit qu'il y a un vrai effort qui est fait, mais ce n'est pas dans la majorité des plans de cours, surtout en intervention, dans les cours, sur les cours sur l'intervention qu'on analyse, eh bien, il y a très peu de choses qui sont dites. Je vais prioriser un ensemble de questions qui sont surtout pour les autres panélistes, parce que je pense que c'est extrêmement important. Peut-être pour la protection de l'enfance, par exemple, une question qui dit, I would like to ask about the intersectionality between immigration, integration, and this reality we are discussing. Do you have some data or studies about it? Je pense que peut-être que maybe I will let Wendy to answer to that question about immigration, integration. I know we spoke about that in our research about some people who don't have enough network in the cities in Canada, and that is one of the risk factor to have the children implicated within the child welfare system. So I would like to know, Wendy, if you have some thought about that.
Sorry, Jude Mary, I was reading and listening to you at the same time, and both just don't work for me.
Yeah.
So if you can just repeat that, please.
Yeah, I can read the question again. I would like to ask about the intersectionality between immigration, integration, and this reality we are discussing. Do you have some data or studies about it? About integration, immigration, and the overrepresentation of Black children?
Well, in our data, and Jane, I know Jane is on this line and she may be able to add to this. Okay, so Jana has responded. We don't have any data at this time about intersectionality. Can you hear me clearly?
Yes.
Okay, so we don't have data on intersectionality. We do continue to gather data on the race and the ethnicity of our children that we work with.
I can probably add something to the conversation, if that's okay, Dr. Cénat.
Yes.
Because we recognize that there is intersectionality. And so lots of the work that we've been doing is with newcomer communities, recognizing that it is a community that we want to work with and provide support to, in particular, because we don't want that community to then be part of the overrepresentation. And so we work with various organizations and organizations that support newcomers, for example, the Catholic Center for Immigration, to make sure that when we do have involvement with the newcomer community, we can link back to the community that's situated here in Ottawa to support that family. We ran and continue, we didn't during COVID, but we ran classes through the LINK program for newcomer communities, especially around legislation. One of the biggest questions we keep getting is, how old is a child allowed to be to remain at home alone? And so information like that, just so that we can support families who are new to Ottawa. So I don't know if that answers it, but that's some of the work that we've been doing with that group.
I have another question. Why do experts continue to focus on Black families in child welfare without a holistic review of comprehensive family policy for Black communities? I think that also, of course, with what we found in our research, is the fact that there is poverty, there is a lot of things we can understand within the Black families that can explain the overrepresentation of Black children. And I want to hear you about that. Why do experts continue, or maybe the child welfare system continue to focus on Black families in child welfare without a holistic review of comprehensive family policy for Black communities?
Yeah, in fact, I saw that question in the chat, and I thought it was an excellent question. And it's an important question. So child welfare organizations typically focus on their corridor, which is child protection. But why don't we do that? Because we often say that. We'll say poverty is a contributor, but white families live in poverty too, yet they're still not overrepresented. White families suffer from mental health, yet they're still not overrepresented. And so it is an important question. And as a society and as a collective, perhaps as the City of Ottawa, we have to look at that. That there has to be a broader policy because one of the presenters talked about the cycle of if education is racist, then police might be racist. And so it goes and so it goes. And so are CASs. And so I don't have an answer, but I think it's a really important thing for all of us to look at as we work in public service and work with families across the city and across the province.
Experiencing structural inequalities should not lead to child welfare intervention and making changes to the child welfare workers in society policies. And training will not address this. These are insufficient supports for families struggling to parent children who have with additional needs, or for parents who are struggling with their own needs. Child welfare involvement should not begin if you are unable to access or pay for the private support. However, at this time, these services are not available. Are there any plans to apply this research and recommendations to address structural inequalities that are driving many of the child welfare interventions? I think this question is for people from the child welfare.
Yeah, I totally agree with you as well. I think probably most of the questions are for child welfare. Yes, I mean, I would agree with that one as well. That there just has to be so many more things done. Training is inadequate. And so I hope that you heard in Wendy's presentation that she was trying to link the recommendations that came from this research to the things that we are doing. And so training is not enough. And, you know, typically people talked about three things. You have to hire from diverse communities to get diversity within your organization. You have to train, but that can't be the only thing that you do. And you have to make sure that you are partnered with organizations in the City of Ottawa who are serving the communities that you are serving. But some of the things I hope you heard from what Wendy was presenting is that you also have to have circuit breakers. And what we mean by that is that you have to have processes in your organization that stop the speed and get us to critically look at why are we opening an investigation file on this family? What are the things that are worrying us? And she mentioned a rigorous focus on child safety, not on what the parent comes with, but how whatever the parent comes with impacts the safety of the child. So you won't get disagreement from us. That's the things that we're trying to do through the work that we're doing, which, by the way, is not an initiative. We want this work to be integrated through everything that we do every day.
Maybe I can take another question. Thanks for your presentation, Wendy. There's a clear overrepresentation of Black children in care, but based on CASO's data, there is also a clear underrepresentation of other ethnic communities like the Asian community. What is preventing these communities from coming to the front door of CAS? Is there anything that can be applied to the Black community? I think it is a real good question.
Yeah, I know. I want to meet that woman because her questions, she's had a few of them in the chat and they're brilliant. So I don't know the answer to that, quite honestly, but I really like the question. We don't typically compare those who don't come to our front door with those who do come to our front door. For the most part, we're worried about why is there an overrepresentation of Indigenous families and racialized and Black families as well. So I don't know that. I have some theories, but they've not been tested and I don't know what that is about, but it is an area that we should be exploring. Why is certain communities who are racialized not coming to our attention, not being referred, but also not being treated the way we treat others? And so what we worry in the disparities is that if a Black family comes to our door, an investigation is opened. That file is then transferred for ongoing services. Those children are more likely to be apprehended. Those children are more likely to have become wards of the Crown, meaning that they're in our care permanently. So it is an interesting question and one that deserves exploration. And perhaps, Dr. Cénat, that can be your next project.
Peut-être, maybe I can give some answer as also. Ce qui arrive aussi, c'est que par rapport à certaines communautés, on peut avoir des préjugés extrêmement positifs aussi qui peuvent l'expliquer. Par exemple, même si il y a plein de préjugés, les personnes issues des communautés asiatiques vivent d'autres formes de racisme sur d'autres enjeux, que ce soit par rapport à la nourriture, que ce soit par rapport à la santé. Et la COVID-19 n'a pas arrangé, la pandémie de la COVID-19 n'a pas arrangé les choses. Mais pour ce qui concerne l'éducation des enfants, il y a ce qu'on appelle le forbidden culture, où vraiment ce sont des personnes qui vont, pour essayer de prévenir ces choses-là, vont essayer de s'effacer. Aussi, et on a l'impression que même dans nos cours à l'université, même dans d'autres sphères, on a l'impression que ce sont des groupes qui peuvent ne pas exister, mais ce sont des groupes qui peuvent ne pas exister pour se protéger justement, ne pas se faire remarquer, ne pas se faire voir. Et par rapport à ça, les parcours aussi, les parcours historiques ne sont pas les mêmes. Les parcours historiques des communautés noires en Amérique du Nord, ce sont des parcours qui sont liés à l'esclavage. Ce sont également des parcours qui sont liés à des immigrations, qui sont liés à aussi des enjeux politiques et de violence. Et donc, ce ne sont pas les mêmes parcours, mais aussi, je pense que le cœur de ma réponse, c'est la question des formes de préjugés qui sont des formes différentes, où on va surtout penser que les communautés noires, ils battent leurs enfants, on pense qu'il y a beaucoup de violence, et par rapport à ça, le racisme sur ces enjeux-là sont plus forts, et ce sont aussi les mêmes choses qu'on constate aux États-Unis. Ce qu'on commence à constater, par exemple, au Canada, de plus en plus, c'est qu'on commence à constater également une surreprésentation des enfants arabes dans la protection de l'enfance un peu partout au Canada. Et je pense que ça, ce sera aussi une nouvelle forme de surreprésentation avec laquelle il va falloir sur laquelle il va falloir travailler dans les prochaines années, parce que justement, nos préjugés sur ces communautés-là, ce sont des préjugés qui prêtent justement à une surreprésentation. Il y a d'autres éléments dans le chat que j'aimerais vraiment répondre sur la disponibilité des documents. Sur notre site, il y aura ces documents à la fois en français et en anglais. Et donc, si vous voulez y avoir accès, vous pouvez y avoir accès. Il y a quelqu'un qui dit exactement, Jude, les préjugés positifs envers certaines communautés. D'ailleurs, généralement, quand on parle d'immigration spécialement, les communautés noires ne sont pas perçues et traitées de la même manière. Je pense que les nouveaux chiffres sur l'immigration le montrent. Les personnes qui ont de moins en moins de visas depuis l'arrivée du gouvernement Trudeau au pouvoir, ce sont les personnes à la fois issues des communautés africaines et issues des communautés caribéennes. Donc, ce sont des choses qui aussi peuvent expliquer différents éléments. Est-ce qu'on prend deux autres questions pour clore? Deux autres questions. When it comes to the parenting styles of Black and immigrant families, do you think the inclusion of positive parenting techniques should influence the outcome of many of these cases? For example, teaching Black parents how to positive parent and discipline can improve the relations in families.
Yeah, that is always a very, very difficult question, because it assumes that individuals from Black and racialized communities require parenting interventions. And so, we're slightly reticent because we see poor parenting practices. If you look back at it quite critically, we might see poor parenting practices in a much different way. We may see them in white communities, Asian communities, and Black communities. And so suggesting then that in the Black communities, we have to teach people how to parent seems wrong. When for the most part, children's aid societies become involved because of the underlying issues that have been identified here: poverty across all groups, poverty, mental health, addictions, and domestic violence. And so one of the suggestions that has come out is to put out a booklet on parenting. We do that. We have small publications where we put booklets out to talk about positive parenting, positive discipline, but it's not geared towards a specific group. It is meant for anybody who is interested in learning positive parenting, gentle parenting, disciplining in a different way.
Je pense que il y a une question qui est dans le chat que j'aimerais vraiment répondre. C'est-à-dire, le groupe des professionnels impliqués dans la protection de l'enfance est varié. Qu'en est-il de la formation donnée aux autres catégories et institutions à part les travailleurs sociaux? Dans les recommandations, il y a ce point-là, c'est qu'il faut former à la fois les enseignants qui signalent beaucoup plus des personnes, des enfants issus des communautés noires et des fois pour des enjeux tellement mineurs qu'on demande comment la personne a pu signaler. Ça, c'est une première chose. Pourtant, des jeunes blancs qui devraient être signalés ne sont pas signalés. Et je pense que cette disparité-là constitue également un danger pour les jeunes blancs eux-mêmes. Et je suis sûr, par exemple, la fillette de Granby, si elle était noire, elle ne serait pas morte comme elle est morte. Il y aurait eu des dispositions qui auraient été prises. Et ça, ce sont des enjeux, et non seulement les enseignants, mais également les gestionnaires qu'il faut former, tous ceux qui ont des contacts avec les enfants, mais également les juges, les avocats. Je pense qu'il faut vraiment former toute la chaîne des personnes qui ont des contacts avec les enfants, avec les familles, pour pouvoir résoudre cette question-là. Maybe, I don't know, peut-être qu'on pourrait écouter le cadre. Sinon, je sais qu'il y a beaucoup de questions. Merci à Leigh Hamilton pour plein de commentaires. On en tient compte. Peut-être que je pourrais demander pour terminer, demander à Cadra de dire 30 secondes chacun. Cadra 30 secondes, Wendy 30 seconds. Je pense que ça pourrait être une bonne façon de terminer la conférence d'aujourd'hui parce que, en fait, allez-y, Cadra.
Merci Jude. Mais j'ai préféré si vous me donnez un peu plus de 30 secondes en répondant à la question qui était demandée et la dame, elle avait répondu que il y a, d'après ce que j'ai compris, qu'on donne des cours ou bien des formations pour les parents. La majorité, les parents qui est référée par la Société de l'enfance concernant la discipline ou bien le comportement ou bien l'accompagnement parental, je ne vois pas ça. Je vois qu'il y a un manque d'entente, il y a une sous-estimation parce que je travaille assez avec les familles et je vois que les familles, ils sont là d'accord à faire la discipline et ils font la discipline de leur façon qui n'est pas vulgaire, qui n'est pas violent, mais mal compris et mal jugé. C'est ça que moi, je vois et je préfère qu'on commence à travailler sur ça. Il y a un manque de sensibilité et bias culturel. Et j'aimerais bien qu'on travaille avec ça. On est là comme experts d'accompagner les parents racialisés et on peut travailler plus pour avoir la réunification de leurs enfants et l'harmonie de la famille. Merci.
Merci, Cadra. Peut-être juste faire un petit écho avant que je donne la parole à Wendy. Ces 3 derniers mois, nous avons été interpellés par quelque chose. C'est beaucoup de jeunes qui sont pris en charge présentement par la protection de l'enfance qui nous appellent parce qu'ils veulent participer à nos études alors que ça ne les concerne pas. Et ils disent, nous sommes victimes de racisme de la part des intervenants. Et ça, c'est pas, je ne parle pas de la Société d'aide à l'enfance d'Ottawa uniquement, mais en Ontario de manière générale. Et on en a eu également au Québec. Et ça, c'est quelque chose qui nous a interpellés et qui, je pense qu'il faudra travailler sur ce qui est fait dans la protection de l'enfance, mais également comment ça se témoigne, comment ça se traduit vraiment dans les services qui sont fournis.
Absolument.
Désolé, Wendy, vous avez carte blanche pour parler pour pouvoir conclure.
Oh, thank you, Dr. Cénat. I just wanted to echo something I mentioned in my presentation, and that is the need for the community to assist. We can't do this work alone. We do need others involved. Families do need the help and the support of their own community. So when you hear a request or an ask or a reach out, I hope someone does grab that and or connect with us to see how they can become involved and how they can help us in doing better work. And also, I just wanted to add that we do keep our website very updated. Our stats are on our site if you're looking for more information about our numbers. So thank you. And thank you for today. It was great hearing from the audience. It was great hearing what your committee has been doing, as well as Rep Pro, and hopefully we'll be doing this again next year.
Merci beaucoup Wendy White, merci beaucoup Cadre Ahmed, merci vraiment à tous les intervenants, Debbie Hoffman et tous les intervenants. J'aimerais vraiment prendre le temps de remercier à nouveau les organismes communautaires qui nous aident dans ce travail-là. C'est important. Sans eux, ce ne serait pas possible. Et j'aimerais aussi prendre le temps pour remercier la Société d'aide à l'enfance d'Ottawa pour cette ouverture. Et je pense que cette ouverture à la recherche, mais également à travailler avec les communautés, c'est une ouverture qui pourra permettre de réduire, je l'espère, et d'éliminer, c'est l'objectif, dans les 10 prochaines années, la surreprésentation des enfants noirs dans la protection de l'enfance, parce qu'après, c'est fragiliser des enfants, et quand on les fragilise, eh bien après, ils ont moins de services, ils contribuent moins à la société, et en contribuant moins à la société, ça en fait de moins bons citoyens. Et je pense que tout le pays a du bon à gagner que de permettre aux jeunes issus des communautés noires d'atteindre leur plein potentiel et de pouvoir s'épanouir. Merci encore à tous et merci à tous ceux qui ont pu nous rejoindre aujourd'hui. Comme on a mis dans le chat, il y a le site du labo où il y aura tous les documents que nous avons mentionnés aujourd'hui. Merci beaucoup.